for the Lunch and Learn webinar. I know there's a few people online and a few more to join in, but I think it's probably best that we get started just in the interest of time. This webinar is being recorded just so that we're aware that there's a lot more people who probably want to watch this but are unable to attend due to prior commitments. So this will be available on our immunization website. We'll also be uploading a number of resources that have been developed to support some of this work as well. So, and I just wanted to introduce some of the panelists who are with me this afternoon. So we've got Dr. Eimear Hayes, who's our Senior Medical Officer within the National Immunisation Office. And we've also got Ms. Cría Dowling, who's our Communications Officer within the National Immunisation Office and also leads on the flu programme communications here as well. And we've got our Communications Manager, Ms. Yvonne Morris, as well, who will be moderating the chat. So if you have any questions, feel free to drop them into the chat and we'll answer them as we go along as well. So I suppose just to kind of start with really just what we're going to be talking about today. So a little bit about the flu activity that we've seen so far based on the surveillance data from HPSE and uptake rates, going through a little bit on the importance of the flu vaccine, how to talk to people about the vaccines, just a bit about, what vaccines are available and frequently asked questions. But hopefully it'll be clear as we go through the program itself. So maybe I'll just kick off with a little bit about flu activity and also the uptake rates, because I know everyone's really interested in this data that we're seeing during this season. And I suppose it'll also highlight why we're hosting this Launch and Learn webinar mid-season to really try and push that uptake rates for health and care workers this season. So starting off with flu activity, so this is taken from the HPSE surveillance data that's available on their website. So they release it every Thursday during the flu season, just to highlight, how many cases of flu there have been, how many hospitalizations, and how many deaths, unfortunately, as well. So since the start of October, for this season, there have been over 1,000 confirmed flu cases already that have been notified to HPSE. And unfortunately, 361 of these cases are reported in hospital inpatients. And there have also been 12 cases admitted into critical care as well. And sadly, as I mentioned, there have been four deaths this season as well due to flu. HPSE have said that flu is currently circulating in Ireland, and they have put out an antiviral notice. So this is really to say certain conditions whereby clinicians should think about using antivirals to support people, particularly those with underlying health conditions and other risk factors and complications of flu. So there's actually an antiviral guidelines on the HPSE website if people are interested in that as well. But that antiviral notice has gone out this season from HPSE. Also to note that flu is also widely circulating in other countries in Europe, so particularly Scotland and Germany. There's widespread activity there. You may have also noticed that in the UK, they're sounding alarm bells about the number of cases of flu being admitted into hospital. So they've actually said that the amount of flu that's been, cases that are going into hospital is actually higher than COVID at the moment. So they're really encouraging a drive and a push on vaccinations, particularly in children, but also in healthcare workers and other at-risk groups as well. So it's just a bit of a warning sign that flu season is coming, and WHO have also advised, particularly, because it's a COVID season as well, to be wary of both of those co-circulating, as we were mentioning. Just to show you a bit on the right-hand side, the importance of surveillance, really, we are seeing an earlier than expected flu season. So you'll see that the red line is the flu season for this year. So the other lines that we're seeing, the green, the pink, and the blue lines, and the grey lines are for the previous season. So you can see that the previous season actually started off a bit later in week 47 onwards, but we have seen a gradual increase in flu cases earlier this season. So what we are saying in the National Flu Steering Group is that there's a golden window of opportunity within the next couple of weeks to really push forward that vaccination drive in health and care workers, because flu season is about to start fairly rapidly, and it is starting earlier than expected. The bottom graph there shows a little bit in terms of age-specific rates of flu notifications, and you notice particularly children are the highest. The under fours the 4 years and under children are very high, but the next highest one is unsurprising, is the 65 pluses. So really our patients who are in hospital, the people we care for in long-term care facilities tend to be primarily in that demographic of older adults. So really high rates seen in those two groups. So hence why those two groups really are the focus of our flu vaccination activities these next few weeks. We actually had a lunch and learn webinar on the children's flu vaccine last week. There's a recording of that if people are interested in it, and that will be available shortly on the immunization website as well. So just a little bit in terms of, as we're focusing on healthcare workers within this webinar itself, just a really quick light touch on what the uptake has been like in previous seasons. So last season, the uptake in the acute sector, hospital-based healthcare workers was 64%. This was actually a drop from the previous season in 2020, where it was actually 71%. So that is a worrying trend that we're seeing there. And again, a similar trend in care workers working in long-term care facilities. There, last year, the uptake was 55%. This was a 10% drop from the previous season, which was 66%. So really important to be wary that seems to be a bit of a downward trend in healthcare worker uptake. And we'll go through a few reasons on that a bit later on in terms of the research we've done this season. So where are we in terms of this season? So luckily, we've actually got a system called COVAX, which we're using for COVID. We are also using it for flu this season, so we're able to get real-time uptake on flu vaccine administration. So you'll be pleased to know, I suppose, one of the markers is that we've actually reached the 1 million flu vaccine administered dose marker a couple of weeks ago, and so that's worth celebrating. But obviously, as I mentioned, we need to really focus on a couple of areas, which is our children and our healthcare worker uptake. And the reason for that, for example, is that on Monday, when we pull this data from the dashboard, taking data from COVAX, just shy of 120,000 health and care workers were recorded on COVAX as having had their flu vaccine. Where healthcare workers are going to get their flu vaccine is interesting as well, because health and care workers can get it for free at their GP pharmacy or at their workplace if they have peer vaccinators. So it's interesting that actually 28% are going to their GP, 26% are going to their pharmacy. So that's nearly, more than half of the healthcare workers are actually going to primary care to get their vaccine, and the rest are getting it at their workplace. So 29% in the acute sector and 18% in the community health organizations. But interestingly enough, though, at the same period last year, just looking at the PCRS data, so just from primary care, so GPs and pharmacies had recorded about 120,000 healthcare workers. So it's interesting that there has been a significant drop. Perhaps some of these healthcare workers have gone to their peer vaccinators, but it is worrying to see that there is a drop comparable to the previous year. And as if you may remember, I also said comparing last year to the year before, there was actually a significant drop. So it is really important that we're focusing on this. So what are we doing at a national level, I suppose, to try and improve uptake? There's a big data and information drive. And I'll explain a little bit about why we're doing that in a bit. But we are trying to also expand out access to COVAX through what we're calling a community vax portal to Section 39s and private organizations. So because those organizations don't have access to COVAX at the moment for flu recording. We're also doing some research, and I'll share some of the findings from the research. There's also a point prevalence survey that's also going to be that has been sent out actually by the HPSE. The deadline for completion of that is the middle of December. And the reason for that is that our COVAX data, the GP and pharmacy data, is not able to identify where a person works, or where the healthcare worker is, the workplace location. So that can be an issue in terms of our data, and I'll just go through in the next couple of slides what the data looks like, and not including those. But there is a piece of work also ongoing at the moment, trying to link that COVAX data with HR data to try and get more accurate uptake figures, but in line with GDPR rules and regulations as well. We're also doing locally driven improvement plans as well. So we're very fortunate to have flu leads in each of the CHOs and hospital groups, and they're doing a really big push on trying to improve uptake at the local level. And there's also flu leads have access to the flu dashboards as well, so they have access to the information of what's going on in their local area. And a part of this improvement uptake is also things like what we're doing today, which is the training and education and developments of tools from a national level to support local work as well. So, as I mentioned, the GP and pharmacy data, we can't link it to a specific place of work, and over 50% of healthcare workers have gone there for their flu vaccine. But from the data that we do have on that's been linked to hospital groups or CHOs, what we can say is uptake at the moment is around 44%. But true uptake is likely to be higher because some of the people from GP and pharmacy who've gone into those sectors actually will fall into the hospital group data as well. So uptake around 44% at the moment, and further work is needed to kind of improve that data quality there. Similarly, when you look at community health organizations, again, uptake is around 31%, and similar issues with the hospital group. There may be some who are not included in here who have gone to their GP and pharmacy to get their flu vaccine as well. So next, I'm just going to go through a little bit about why it's so important to encourage flu vaccine uptake in our healthcare workers. So flu in general can have a really significant impact, particularly in our older populations and those with underlying health conditions, and in children, younger children in particular, and also in pregnant women as well. Although, flu can have a significant impact on some people, in other people, it can actually be asymptomatic in 3/4 of cases. So that's why it's really important that health and care workers actually get the flu vaccine, because they may actually have flu without even knowing it. So it's really important that they are protected so that they are protecting other people that they care for as well. And it's important, as I mentioned before, that elderly people are significantly impacted by flu, and that's because they have because of their age, they tend to also be more susceptible to chronic diseases, which puts them at higher risk of morbidity and also mortality from flu as well. And it's not unsurprising that actually 80 to 90% of deaths reported from flu actually occur in older adults. And just to mention that, the 2017-18 flu season was particularly bad. And if you look at that flu season and the impact that it had, it shows that flu can have a devastating impact, not only on people, but also on the health and care system. For example, the number of people that were hospitalized was around 4,700. There was also 191 admissions to critical care, and there was unfortunately 255 deaths as well. And it's worth noting that there were 223 confirmed flu outbreaks that were reported. And you can all imagine, especially if there's a flu outbreak in a local care home, or in a hospital setting, how much effort it takes, to, I suppose, put the infection prevention and control in place as well. So it's just worth noting the impact that a severe flu season can have on our health and care system. But it's also worth noting that behind these numbers is a person. So each person and their family that's impacted by flu as well. So next, we're going to be talking a little bit about why is it important for health and care workers to be vaccinated. And as I said, mentioned before, 3/4 of people won't even have symptoms, but that doesn't mean they won't spread the infection to high risk people that they're caring for. It's also worth noting that studies have been done which show that healthcare workers are 10 times more likely to get flu from the general population, and it's thought that at least a fifth of healthcare workers are infected with flu each year and continue to work in spite of being ill. That's because they probably don't know that they've got flu. And also it increases the risk of spread to their colleagues and also to their patients. Other studies have shown that during hospitalization, patients are in general 5 to 35 times more likely to acquire flu if they're exposed to infected patients or to infected healthcare workers. You'll also notice that other data shows that if there's a high level of healthcare worker vaccination in the institutions that they work in, there's actually reduced rates of flu-like illness, hospitalization, and deaths from flu in older adults and also in healthcare workers' sick leave. And this is data that's coming from Europe. In particular, I just wanted to focus a little bit of time on long-term care facilities because this is where, I suppose older adults in particular and vulnerable people are located, and flu outbreaks occur here each year in long-term care facilities, and it poses a serious impact on the people who are most vulnerable to complications. And also staff absences during this period of time can place a lot of pressure on our facilities to maintaining safe staffing levels as well. So I think this is a question we get asked quite commonly about who within, who's considered as a health and care worker really. And it's really important that, all medical, nursing and allied health professionals, including those working in residential and disability facilities and students, general support staff, dental personnel, hospital porters and cleaners, ambulance personnel, carers and home helps, all GP and pharmacy staff and agency staff who fall into those categories are all eligible for their flu vaccine. So please make sure that the flu vaccine is widely publicized, and also all of those who should receive the information know that it's a free flu vaccine and they can get it from their GP or pharmacy or from their workplace if it's being offered there. So we did a bit of research actually with Core Research, who are our partners in our communications team, in the HSE communications team. And so they did a research on the on a panel of healthcare workers, 57 healthcare workers between August and November this year, to understand, what the feedback is from healthcare workers, what's stopping them from getting the vaccine, what would motivate them from getting the vaccine. And we really did that using a mix of qualitative and quantitative methods. So really trying to get those, open-ended and close-ended questions to get, rich feedback on these topics. We actually included questions about COVID-19 as well, because we were thinking about, it's not just about flu, but really around what is there some impact on having COVID-19 with flu, and what that could be. So the next few slides are just a bit of a snippet from that research, focusing primarily on flu, I suppose. So starting with the motivations to get the flu vaccine. So interestingly enough, the motivations for getting the flu vaccine are also very similar to what they identified as the motivations for getting the COVID vaccine. So really, healthcare workers felt that they should get these two vaccines because of their professional responsibility, right? Because they don't want to make other people that they're caring for sick. Self-protection because they don't want to get sick, and also because they're at risk. For example, our healthcare workers who have underlying health conditions, such as asthma, etc., they don't want to get sick themselves. So those were the three main reasons why people were getting the flu vaccine. Sorry about that. So we also asked in the research, what were some of the barriers to getting the flu vaccine? So interestingly, the barriers for the flu vaccine were actually different to the barriers that they expressed for the COVID-19 vaccine booster. So just focusing on the flu vaccine to start off with, they didn't think they wanted to get the flu vaccine because there was a low perceived risk, because they thought, oh, it's not really needed, because they've had no previous experience of flu, and they were concerned about, does it really offer good protection? So those were the questions that they had around the flu vaccine. Around COVID-19 vaccine, it was slightly different. So they thought if they wore the right PPE, etc., they wouldn't get COVID-19. They were uncertain, if they needed it, how many doses they were needed, when they were due. Those kind of questions kept coming up. And some of them were saying they were actually living with long COVID, so they weren't sure how the vaccine would help them. So those were slightly different questions, I suppose, in terms of why people were hesitant about the COVID-19 vaccine versus the flu vaccine, which I thought was really interesting, actually. So next, we also asked healthcare workers, so what can we do to try and really improve uptake in healthcare workers? And we wanted to hear it from them about what they felt would be most powerful. And they were really things that came into four different categories. One was communication. So they wanted people to frequently mention it and promote it in meetings, and they thought that was really important, particularly leadership. So for example, department heads promoting it was really important because it showcased how important it was for people to get it. Clear, factual, and expert advice was another key takeaway from that setting. Interestingly enough, I suppose, I thought the quotes from the research were also really helpful for me. So, for example, one person said, normalize it. Seeing leadership get their vaccines and setting examples can be really powerful. So that's why I suppose this year we've, ensured that, different, I suppose, leaderships and ministers, we're taking pictures and promoting and showing that actually, and setting the example of getting the flu vaccine. And I think flu leads have done the same thing on a local level as well. So local leaders that people recognize, they've been using them and actually promoting it through their departments as well. Access is another key thing. So access keeps coming up for both vaccines. And I suppose the operational elements of both the flu and COVID are slightly different. But in terms of access for for these vaccines is really about keeping up with the clinics and promotions in the workplace. So really promoting them to healthcare workers, having consistent locations, and so that it's clearly signposted as well, so that people know where to go and when to go there, and having a range of times, particularly for people who are working shift work, and doing it in a non-judgmental way. Um, and there was also a bit of a suggestion that, perhaps, there's more work that's going on in section, HSE organizations versus section 39 organizations and private organizations. So it's really promoting the fact that there is still that GP and pharmacy option for those healthcare workers who may not have, unfortunately, have access to a peer vaccination program near them, particularly in the private sector. There's also information gap as well. So healthcare workers felt that, we needed to give more information on possible consequences and also the benefits of getting the vaccine. And we're going to take this on board for next flu season and really think about, how can we tailor the information leaflets that we have to highlight some of these other questions, perhaps more in detail. And channel of promotion as well. So healthcare workers mentioned, emails for staff, posters on workplaces, some of which are already being done, and also using the hospital notice board and also social media, I suppose, as an emerging platform as well. So really highlighting some of those things, and as I said, the quotes for me were really powerful in terms of how we distilled these themes about how we can encourage uptake. And we also asked healthcare workers where do they go to for their information. And I suppose the really helpful thing really is that they do go to our HSE website and also use our vaccine leaflets and booklets. They also visit the NHS website, the Immunisation Office social media, information campaign, and health experts in the media, and also data surrounding efficacy. So it's worth noting that when you are promoting the flu vaccine, I suppose it's really simple to say we have a dedicated flu website, which has a dedicated page on healthcare worker information. So if you just tell people, go to hse.ie/flu to get the best information for you, or speak to a trusted healthcare professional. So those would be the two main things that I would do if someone asked me, where can I go for information this season? We also asked, I suppose, healthcare workers, are there any initiatives that we can use to improve uptake? So, for example, would a free tea or coffee help? Actually, what they said was what they found to be most, I suppose, popular, and they found that would be most interesting to try and use as an initiative would be the UNICEF initiative. So UNICEF, give a vaccine, get a vaccine concept. So they really liked that because they liked the idea of doing good while they're getting their vaccine, and also, they felt that they were slightly uncomfortable with the use of other incentives, I suppose, to try and encouragement things like, merchandise and things. Although some people felt it was beneficial, others felt, you know, people shouldn't be incentivized to get the vaccine. They should just be, given the information to make that decision. So I suppose it's just worth noting that. There was also other initiatives that were discussed as well. For example, they were asked, they said that they'd like to see their peers and staff across all the HSE getting their vaccination. So really promoting vaccines, and I think it provides like a positive feedback to others to say, actually, they're getting their vaccine, maybe I should get it too. And 50% thought that would be really impactful. Communicating on the benefits and efficacy, and I think we can't stress this enough, really trying to make sure healthcare workers understand why it's so important, what the benefits of getting vaccinations are, and how protective flu vaccines can be. And 65% of healthcare workers thought that was really impactful. And also reminding staff about the risks of not getting vaccinated. Again, another 50% thought that was really helpful. We also asked them about getting water and paracetamol afterwards to limit any side effects. People thought actually only 15% thought that would be impactful, and another 50% thought they might have some benefit. But as I said before, I think some of the main feedback that we're getting back from the healthcare worker panel is it may not encourage, but it's also, it's really about trying to give people the right information to get the vaccine. I think is the key initiative that we should be focusing on. So I suppose the main takeaways from this really are about promotion. really normalizing getting the flu vaccine, getting as many people on board getting the flu vaccine. I think it has a snowballing effect on trying to get others on board, providing the right advice, making it easy for people to get the vaccine. So, in terms of locations, having the accessibility, and really motivating them with the right, clear, factual information. And I just wanted to share with you a quick video that we had done last season, actually, which captures some of this information, I suppose, for healthcare workers, and it might be helpful for you.
I knew somebody was on the side about vaccination. I would highly recommend they get the jab because I have had it for many years now. Sometimes I have no negative towards it. It has reduced symptoms that I have. So in that respect, I would recommend to anybody else thinking about that. Yes, go ahead. Well, it's 1 year that I did the thing. I got very ill until December. It was approximately 10 years ago, and ever since then, I would be first of the queue in my organization to get the vaccine. They're very grateful. To get the vaccine, if you're working,
I think some people can't hear that. So maybe what I'll do is I'll share the video a bit later on. So I will share with you the link, as Yvonne was saying. Sorry about that. So really what that video was trying to show was what some people were trying to do is encourage some of those messages that we've been talking about in the research and how they translate into real people talking about them. But that's okay. We'll put them in the YouTube video, so hopefully people will have a chance to look at it afterwards. Sorry about that. So next, I'll hand you over to Cría, if that's okay, just to talk about, care workers and focusing on our long-term care facilities. As I said, that's a really important part of our campaign this year.
Thank you, Aparna. Thanks, Aparna. As you know, the HSE's flu vaccine campaign launched this year in October. It's an ongoing campaign that will run until the end of April next year when the flu season ends. The flu vaccine campaign aligns with the HSE's overall winter vaccine campaign, encouraging people to be protected this winter and get the vaccines that are recommended for them. For flu, we focus our communications on the key target groups. So children aged 2 to 17, their parents and guardians, at-risk groups, including those who are pregnant, those with certain long-term medical conditions, and people aged 65 and over, and of course, health and care workers. For this year, our campaign's main objectives are to achieve the target uptake for this current flu season, that's 75% for health and care workers, to give everyone who can get the free flu vaccine, including health and care workers, the information they need to make an informed decision, and to position the HSE and the NIO as trusted sources of information. Next slide, please. So as I previously mentioned, the target uptake for this year is 75% for health and care workers. Last year, the uptake of flu vaccine among staff in long-term care facilities declined. And to address this decline, as Aparna mentioned, we conducted qualitative and quantitative research this year to sort of explore those the barriers and motivations to flu vaccine among staff in long-term care facilities. So as part of this research, we conducted focus groups with management and frontline staff, with aim then to use these insights to inform a more targeted communications campaign. And as Aparna explained previously, from our research, we discovered some motivations and triggers for why staff get the flu vaccine. The main ones being their protection themselves and protecting others around them, like their family, colleagues. They also felt a professional responsibility to protect the residents that they're caring for and to protect the health services. They also understood that a flu outbreak would mean extra work, and they want to prevent the spread of flu as much as they could. And the easier that it was to get the flu vaccine, say for instance, the more flexible clinic times were, the more inclined healthcare workers were to go off and get the vaccine. And seeing their peers would also be a trigger for them to get the flu vaccine, so social proof coming into play there. And the more they perceive the flu vaccine as a yearly or annual habit, the more inclined they would be to get the flu vaccine also. In terms of barriers, access was a major issue, and also came up that some health and care workers didn't know they could get the flu vaccine for free at their pharmacy. Perceived low risk, so particularly among younger staff members, they didn't see themselves at risk of flu. And some are also afraid of the adverse effects of getting the flu vaccine and getting flu symptoms from getting vaccinated. Culture was also had a role to play too in people's perceptions of vaccination and perhaps being hesitant to get vaccinated. And some were also hesitant about getting both the flu vaccine and the COVID-19 vaccine. So using these research insights, we then crafted some key messages for a more targeted campaign for healthcare workers and long-term care facilities. The first and the kind of main overarching message being protect yourself and the people that you care for this winter and this flu season. If you work in healthcare, you're more at risk of getting flu. You're up to 10 times more likely to get flu. And that was a message that really resonated with the focus groups. It was quite a strong message. Some older and at-risk patients, they rely on health and care workers to keep them safe, to get vaccinated to help keep them safe, because they might not get sufficient protection themselves from the flu vaccine. The flu vaccine is safe. It's the safest way you can protect yourself, your colleagues, your family, and the vulnerable patients that you're that you're caring for from flu this flu season. And you can get your free annual flu vaccine at your GP pharmacy or clinics that are available in your workplace. Next slide, please. Next slide. Thank you. We incorporated some of these key messages into information materials that we developed for long-term care facilities. So you see we have new posters, we have a new toolkit, which also features a new fact sheet, which is kind of addressing as both the key messages and addressing some of the concerns that healthcare workers might have. And we've also developed social media assets for social media campaign too. And they're all available on the NIO website, immunisation.ie. Some other further resources that are worth highlighting is the HSE Land e-learning module for health and care workers about the flu vaccine. As I mentioned, our toolkits that are once again are available on the NIO website, immunisation.ie. Some of the videos that have been developed last season and also some new ones for this season too. The one that Aparna shared there previously from healthcare workers on why they get the flu vaccine. And there's also a video from Dr. Maeve Ogan that we had from last season about getting the flu vaccine in pregnancy, which is important for healthcare workers that are pregnant. It's important for them to get the vaccine also. And we also have our leaflets and our posters available on hsc.ie/flu and immunisation.ie. It's also just worth mentioning and highlighting the pharmacy finder service that's available on hsc.ie/flu, which could be helpful as well for healthcare workers. It's another channel where they can get their free flu vaccine. Next slide, please. So some success stories from last season. Last flu season, we had 15 long-term care facilities that achieved 100% uptake, and they all won the top prize for the highest uptake among healthcare workers in a long-term care facility with less than 100 patients. And that was the largest number of winners that we had in this category for the NIO Flu Awards to date. And we conducted a case study with 3 of the long-term care facility winners to explore what worked for them last flu season. And we developed this acronym CARE. The first being communicating regularly with staff via regular staff meetings or newsletters. One of the nursing homes mentioned that they had a weekly newsletter that they actually ramped up to a daily edition when they experienced a flu outbreak. And this helped them to deliver clear, precise information to staff and also helped to foster more high levels of trust between management and staff. The second being to accommodate staff, to have flexible clinic times. Some long-term care facilities mentioned how they set up clinics early on and they make sure there's flexible times to fit within people's work schedules. And they also linked in and worked closely with local pharmacies where a lot of their staff also got vaccinated there. The third being there to remind staff consistently on how and where they can get their free flu vaccine via email or text messages. And the last being then to educate staff, so they understand, that the risk of flu, if they get it, and understand why it's important to get vaccinated to prevent the spread of flu, and directing them to those trusted sources of information, particularly the HSE and the NIO website. And just to recap, some tips for improving uptake. Ensuring that all staff are aware of where and how they can get their free flu vaccine. GP, the pharmacy, or clinics at their workplace. For staff who aren't able to attend those local clinics, signpost them to their GP or their pharmacy. You can also direct them to the HSE website, where there's the flu pharmacy finder service, which could also be helpful. Regularly communicating with staff on flu updates in your facility and on clinic times. Once again, via newsletters, email, text reminders, your website. Have HSE information materials and information materials from us, posters, leaflets on display, and make sure that health and care workers know that the flu vaccine is free of charge, no matter where they access it. Thank you.
Thanks, Cría. I'm just going to hand over to Dr. Eimear Hayes to talk about vaccine hesitancy and how to talk to people about vaccines. Thanks, Eimear.
Great. Thanks so much, Aparna. Can you hear me okay?
Yes, we can, Eimear.
Yeah, perfect. Okay, so first I'm going to talk a little bit about where people get their information on vaccinations from. So from GPs, from their family and friends, from official HSE information, from healthcare workers, from their work colleagues, online, from broadcast news, some access information from ourselves in the Immunisation Office, and from other media sources such as the TV, internet, social media. Next slide, please. Great. So what is vaccine hesitancy? So the World Health Organization would define vaccine hesitancy as delay in acceptance or a refusal of vaccinations despite the availability of vaccine services. It's quite complex and context specific and varies across time, place, and which vaccine is involved. Vaccine hesitancy can be influenced by, research shows, by complacency, convenience, and confidence in vaccines. Next slide, please. So we talk about the vaccine acceptance continuum. So vaccine hesitancy can exist along a continuum where some people refuse all vaccines, some people refuse vaccines but they're unsure about it, some will accept some vaccines and delay or refuse others, some will accept vaccines but are unsure about whether they should or not, and then some people accept all vaccines that they're offered. Next slide, please. Thank you. So the objective for any healthcare worker in speaking to someone who is hesitant around vaccines is to help the person who's hesitant to move along this continuum to accept vaccination through communication and through providing information and answering their questions. So in conversation with someone, you can get an idea of where they're lying on this spectrum based on what they say about vaccines. So some people don't trust vaccines, some people say that they don't think they'll get it, they're not sure that it's safe. Some people in the middle of the spectrum would say they don't know, they have some doubts. Then those who accept the vaccine but unsure may say something like, I think I'll get it, but I do have questions. And then someone who is ready to accept the vaccines will say that they're ready. So next slide, please. Great. So if someone is undecided how to proceed, so with someone who refuses all vaccines, evidence showing the advice would be to be non-judgmental, to ask permission to discuss, not to enter into debate, but focus on whatever concerns they might have, and to always leave space for any future discussions, to maintain a professional relationship, not to kind of force anything. For those who are in the hesitant, undecided group, what's important here is a skilled conversation that's collaborative and centered on the person themselves, and that it's a participatory approach, a motivational interviewing approach. For someone who is happy to accept all vaccines, it's important to offer positive encouragement and facilitate the vaccination. Next slide, please. Okay, so for people who are hesitant or undecided, some advice from research would say it's important to be respectful, obviously, and to be open, to ask open-ended questions, to affirm strengths, acknowledge and validate their concerns, such as that obviously, you know, when they're reading worrying information online, validate that concern. It's important to reflect what they're saying so that they feel, so that they do understand that you are hearing them. It's important to ask questions to find out what they know, provide any information that you can offer, and to kind of verify where they stand after that. So now that, for example, now that we've had a chance to talk, how do you feel about the vaccine? It's important to address their specific concerns, not to assume or bring up any other concerns. It's important to summarize the conversation that you've had and describe the action that has that they have decided to take, just to make sure that you're on the same page and that you have communicated effectively with them. So, for example, you've decided to get it, and the action that they're going to take is that they're going to register on the online portal. It's very important to point to other sources of information and always leave the door open to come back. And sometimes it can be relevant to share your own experience. People can find that helpful as well. Next slide, please. Thank you. So if someone refusing all vaccines or refusing a particular vaccine, what's the best approach to maintain kind of the professional relationship and maintain confidence? So taking a non-judgmental approach, for example, you know, I can see you feel strongly about this and that you want to do the best for your health. Ask permission before entering into a discussion. If they agree, offer information, and if they would like to focus on any specific concerns that they have. It's important not to enter into a debate or an argument. For example, saying, you know, I can see that you feel strongly about this. It's important as well to leave, you know, it's your discussion, not to close the door. To remind them that if they ever want to come back and talk about vaccination again, that they're more than welcome. So just important to maintain that professional relationship. So some resources are the HSE Land module talking about immunisation, and the World Health Organization link their conversations to build trust in vaccination for healthcare workers. Next slide, please. So now I'm just going to go through some kind of frequently asked questions that we get in the Immunisation Office around the flu vaccine. So should pregnant healthcare workers be vaccinated? The answer is yes, the vaccine is recommended for all pregnant women. Pregnant women are more likely to get complications from influenza because of changes in their heart and their lung function during pregnancy. If they get influenza while pregnant, they're more likely to need admission to hospital and even to critical care units. Getting influenza in pregnancy may also lead to premature birth, lower birth weight, and even stillbirth. There's evidence that flu vaccination reduces the rate of stillbirth by over 50%. And then even after the baby is born, the flu vaccine continues to provide protection to the baby and the mother for up to 6 months. Infants under the age of 6 months have the highest rate of hospitalization and death from influenza, and the vaccine can be given at any stage in pregnancy. So another question we get is, how effective is the vaccine? So it's important that vaccination is given every year, because flu viruses are constantly changing and immunity from vaccination declines over time. The effectiveness on the vaccine depends on how closely the circulating strains of influenza match with those in the vaccine that year. Influenza vaccines provide seasonally variable protection between 40% to 90% in people less than 65 years. Although the vaccine may be less effective in preventing illness among persons 65 of age and older, it is, however, effective in preventing complications of influenza and death. Among elderly persons living in long-term care facilities, the vaccine is 50 to 60% effective in preventing hospitalization for all causes and 70 to 80% effective in preventing death. Next slide, please. So this is just a little schematic explaining kind of why there is that variability in the flu vaccine effectiveness, because the flu vaccine, it's a complicated virus, and it can change kind of quite easily, quite quickly. So that's why there is that kind of variability from season to season about the effectiveness of the vaccine that is chosen. Next slide, please. So how safe is the vaccine? The flu vaccine is very safe. It has been given for more than 60 years to millions of people worldwide. The injected flu vaccine contains an inactivated virus that cannot give you influenza. If you feel achy or slightly feverish, it's a normal reaction of the immune system to the vaccine. Generally only lasts a day or two. Most effects are mild to moderate and usually disappear within a couple of days without needing treatment. Severe side effects are extremely rare. Next slide, please. So the adverse reactions to the QIV vaccine, which is the vaccine recommended for adults in Ireland, the most common reported adverse effects are pain at the injection site, localized redness and swelling at the injection site, muscle pains and headache in 1 in 10 people. Serious allergic reactions are very rare, and there are very rare reports of Guillain-Barré syndrome in post-marketing setting following QIV. But it's important to note that risk of Guillain-Barré syndrome is several times greater following influenza illness than influenza vaccine. And obviously the summary of product characteristics for any of the vaccines used are available on the HPRA website. Next slide, please. And then the other question would be, can the flu vaccine be given with other vaccines? So yes, co-administration of influenza vaccine and other vaccines may be administered at the same time or at any interval, including the COVID-19 vaccine. Important to note though, it's not known if COVID-19 vaccine reactogenicity is increased with co-administration. So just because of this, the vaccine should preferably be given in different limbs. Next slide, please. And then another common question is around egg allergy. The National Immunisation Advisory Committee guidelines recommend that those with confirmed egg anaphylaxis or egg allergy can be given influenza vaccine in a primary care or school setting, with the exception of those who have required admission to ICU for a severe anaphylaxis to egg. Those requiring non-live influenza vaccine who have had a previous ICU admission for a severe anaphylaxis to egg should be referred for a specialist assessment with regard to vaccine administration in hospital. Next slide, please. And then after vaccination, vaccine recipients should be observed for at least 15 minutes. If this is not practical, they should wait in the vicinity for 15 minutes. The availability of protocols, equipment and drugs necessary for management of anaphylaxis should be checked before each vaccination session. And for post-vaccination advice, any side effects should be reported to the HPRA. It takes around 2 weeks after vaccination to have full protection, there is a chance you may still get the flu, so it's important always to follow kind of public health advice. Thanks. So I might hand back to Aparna there.
Great. Thank you very much, Eimear. So hopefully, I think we've given you a good whistle-stop tour with a focus on healthcare workers. So we've gone through the uptake data that we have so far this season, and also the circulating in terms of surveillance data for flu. We've gone through the research that that the HSE has conducted on healthcare worker panel to understand their motivations and barriers and what the healthcare workers themselves felt would be important in terms of encouraging uptake. Cría's then gone through helpfully in terms of focused research that was undertaken with long-term care facilities, because we felt that that was a specific setting where we felt research was required in terms of to think about what further we could do for care workers in particular. And then Eimear's gone through some of the frequently asked questions, and also talking about, generally in terms of vaccine hesitancy and some of the NIO modules that are there on the HSE land as well. So hopefully that's been helpful for everyone here. So we're going to close the webinar a couple of minutes early. Just before we do, just to remind people, we have our immunization at hse.ie, and that's an email address that any healthcare professional can come to us to ask us any questions that they may have. We're more than happy to answer that. So we've got a number of clinicians, including Eimear and others, and other colleagues who are on there answering those questions. We've also got our immunization.ie website that Cría mentioned as well. So we'll be posting a recording of this webinar on there, together with some of the resources that Cría mentioned, including the toolkits that are there, just for you to have at hand. And, if there are any issues or if you have any questions, feel free to get in touch with our team. And we hope to see you all again very shortly for our next Lunch and Learn webinar.